All right, Dr. Tara, what is happening?
Oh, well, listeners, welcome to our episode as we honor survivors this month since it is October and it's Breast Cancer Awareness Month. And you, our faithful fans, know that this is something very personal here because my partner, Gina Sim, is a beautiful survivor, and we honor women who have beat breast cancer. And today is no different.
Yeah, today I am super excited to have one of my friends on who has been through, for lack of a better word, some shit. And I want her to tell her story and, help to inspire those of you that are going through breast cancer, have gone through breast cancer, or know somebody who's going through breast cancer, because a lot of times, Tara talks about the caregiver angle of it. That's often, a piece of the puzzle that we don't really address. But without further ado, I met this beautiful woman at a networking event in New Jersey years and years ago, and we have stayed connected through the years. So, Tara, who do we have?
Listeners, we are honored today to have in studio Dr. Delores Springs with us. Dr. Springs is not only a breast cancer survivor, but she is the professor of healthcare management, business, and organizational leadership in doctoral programs at 7 universities, a true powerhouse. Dr. Springs, welcome to the Welloff Podcast.
Thank you
Welcome.
so much for having me. I'm so happy to be here.
I'm
We're
doing a little
always
video.
so honored when someone is brave enough to come and share their story with us. So thank you for being here during Breast Cancer Awareness Month and sharing your story with our listeners.
Yes, thank you so much. So, as I mentioned in the intro, that Dolores and I met years and years ago. And then I still remember the day that she called me to tell me that she had just been diagnosed with breast cancer. And it was, very fresh, very new. I was actually driving to LBI. I remember specifically when you called and told me, and it kind of took the wind out of my sails a little bit. And talk to us about your diagnosis and everything that transpired in the beginning.
Yeah, I think, like most women, when you reach a certain age, I was over 40, you hear a lot about getting mammograms. And I kept seeing this commercial come on about getting mammograms, getting mammograms. I said, you know what, let me check myself. And I did, and I found 3 lumps. And I said, oh my gosh, I just knew immediately something is wrong. This
Three
is not
lumps? You found three
I
lumps?
found 3 and I was just investigating. I knew something was, once I found one, I went to town. I was trying to
Yeah.
do the whole workup on myself to
Holy
see what was
cow.
there. I found 3 lumps. I knew immediately something was wrong. I went to see my primary care doctor. She said, yes, she, sent me to get the initial testing. It came back, that something was clearly wrong. And, I said, I need a biopsy. She said, oh, no, it's probably just fibroids. You don't have to worry. I had to advocate for a biopsy. She would not give it to me.
Oh
I
my
said, if you
God.
don't give me this biopsy and I have a cancer, I'm suing you. So she said, oh, yeah, we're going to give you that biopsy. And I said, okay, thank you. And so I went and I contacted my mom because at that time I'm living in New Jersey and my parents and sister and everyone that was really close in my immediate family was living in California. I said, I can't go through this by myself. I was devastated. I was anxious. Just the not knowing and going through all of the initial testing was so scary, and it just provoked so much anxiety. Um, and so my sister and my mom came out. They supported me, and I'll never forget. I waited 7 days for that call. I couldn't sleep. I couldn't eat. I couldn't think straight. I got that call, and he said, "Yeah, I'm sorry to let you know you have cancer." And I said, "What? What kind of cancer? What do you mean? What is it? What?" He's like, "Oh, it's invasive ductal carcinoma." And I'm like, "What is that? What does
What
this
does that
mean?"
mean?
Right. And I'm like, what do I do? Where do I go? And he said, I'm so sorry. You're going to have to, talk to your primary care physician and get an oncologist. And I'm like, well, am I going to die? He said, I can't tell you any more than that. And I'll never forget that day. I screamed louder than I ever have in my life. I collapsed to the ground in my living room. My mom and sister had to physically pick me up off the floor. I was frantic running around the house until I could really get a grip on this, because I initially, only thing I could think is I'm getting ready to pass away. I was scared. And, from there, that's when the journey really began. I was able to get connected to an oncologist immediately. And then I went through some additional testing. And, I'm thinking, oh, and of course, I'm Googling, researching everything, because that is my role. I'm as a professor, I'm a researcher. And so, I look through every possible scenario it could be. And I'm just praying, and I'm a faith-driven woman. So I'm praying and hoping for the best. I'll never forget. And I went in that initial appointment, and I said, I have plans in 6 months. I gotta go here. I gotta move here. And I said, we gotta hurry up and get this thing, I just need the radiation, the surgery, and then we can she said, no, it has spread. You're so far beyond, because my initial thought is, I'm not doing chemo, whatever I don't want to do chemo. I'm not doing it, because I already knew what the impact would be. Mm-hmm. She said, I'm sorry, it has spread. You cannot survive if you do not do chemo. You need everything. You need everything that they have out. You need radiation. You need hormonal therapy. You need chemotherapy. You need immunotherapy. You need targeted therapy. And I was like, it was in shock. And I was crying and sobbing, and they had to have the social workers come in. And that was, and that was the start of me just learning and understanding what this disease was really about. Of course, I went through every treatment that was available, and I was in a clinical trial, and that was a very challenging time. I was thinking I was going to get out in 6 months, but it took years to get through all the treatment.
Wow. How old were you at the time of diagnosis, or how young were you, I should say?
Yes, I was diagnosed in August of 2022, and I was 43 years old.
Wow.
Yeah, just turning 34. Yeah.
Sure.
It was a huge shock. I had so many life plans, and everything in my world stopped.
So I've been following your journey on social, and this journey has taken a lot longer. Like for personally for me, I was diagnosed in April of 2018, did my chemo, my radiation, my surgeries. I was done with all of my treatments, minus the hormone and the immunotherapy and all that. But like with chemo and radiation and surgeries, I was done by January of 2020. No, sorry, 2019. So it was like less than a year that I had to go through all that stuff. Your journey was not like that.
No. And, I think it's unique for everyone. When people hear a cancer diagnosis, they group people together and automatically assume everybody gets the same type of treatment, when that's just not the case. There's so many different, aspects to cancer. And I had triple positive. So I had hormone positive, I was HER2 positive, which means I had to do an extra, they call it 14 cycles, which was an extra year of treatment. And then to see how my body responded. God. Yes. And that was very, very difficult. I said, you know what? I want to live. I want to make it through this. So I said, I'm going to do everything that I possibly can to get through this until it's time for me to say no. And there were times where I had to say, no, this is enough treatment.
So what did you have to do? Tell me about your treatments.
Yeah. So initially, of course, I did the chemo, and just to take a step back, I got into a clinical trial. And I know that's not everyone's experience, but for me, it was something that I needed because my circumstances were a bit more complex, and I thought I would get access to more doctors and nurses. I would get more personalized care. I would get more individualized treatment planning. And I would also have access to the medication that's not on the market. And I thought, this is a great idea. This is, an opportunity for me. And I was able to participate in that. I did the chemo. First I did the immunotherapy. I lost my vision. I thought, oh my God. And they said, oh, we don't know if it's going to come back. I
Wait,
said,
completely blind? Complete
yes,
vision?
it was blurry. I couldn't watch television. I couldn't read text messages. I couldn't work. I couldn't do anything. I couldn't drive.
Oh my
And they
God.
said, oh, and this was the experimental drug. They said, oh, well, yes, we know that it could happen, and we're going to get your eyes checked, and we're going to go through all the steps to, put the eye drops in your eyes every hour on the hour. And I didn't know when or if my vision was going to come back, but I said, that's where my faith came in. And I had to really pray and say, God, please lead me in the right way, because I don't know what I'm doing. I'm just hoping this works. And it did. It worked. I took that drug for 3 months, and then I think about 3 months after I stopped that drug, the vision slowly came back. And then I started on the, some other drugs, the chemo. And then I got neuropathy really bad. And that was so difficult. I couldn't wear clothes. I couldn't take a shower. I couldn't wash my hands. Anything that was touching my body that was even like warm, even like room temperature, it felt like someone was stabbing me, and needles. I had to put ice packs on my body until it was frozen. They said, no more, because you're going to get frostbite. I said, I don't care. You need to give me something or stop this chemo. So they ended up reducing the amount of chemo by 20%. And they gave me a very, very high dosage of gabapentin.
Was it really Taxol?
Yes.
What chemo were you on? Taxol?
It was Taxol. Yeah. And everybody responds differently to treatment. Some people can handle it and tolerate things pretty well, and unfortunately I wasn't able to do that. So, I'm thankful that I was able to get through that course of treatment from, the chemo was difficult. Then I went on to get the double mastectomy. And that was really difficult, especially coming from, personal experience. I've had 2 breast augmentations in the past. So yes,
okay,
I wanted to look
fabulous.
My best. Okay, I want it up and I wanted to feel fabulous.
Tits up.
I was like, as I got older, I said, no, pump, lift, push out. That's and because it was something that a look that I wanted to achieve. And I thought, oh my gosh, I'm losing something, part of my femininity. I'm losing part of something that makes me feel like a woman. And that was a very scary time. And I was able to get through that, but it was a big loss. And so after that, I went into radiation. And I thought, oh, after all I've been through, this should be so easy. All they got to do is zip, zap, and I'm out. And it wasn't quite that simple. It's nothing. Everything you do when it comes to receiving treatment for cancer is a side effect. You're not going to get out of chemo without having a lasting issue. Nobody gets out of it without a lasting lifetime issue. And I have some of my own. So I went into radiation thinking this will be okay. And the whole process, I did 5 weeks of radiation, 25 rounds, and it was not too difficult. And then at the end, I saw, oh my God, my whole chest is black. My back is black. I said, oh my God, my skin is falling off. And I lost it. I said, I can't take anymore. I can't do anymore. I'm done. And they really, I had to get a therapist at that point to really help me, because I knew that I was carrying a lot of heavy burdens of the burden of, am I going to live or die? Should I keep pushing? Because now I'm not living just for myself. I have people who are cheering and rooting for me, but I wanted to give up many times. I really did. I thought this, what? Life is not supposed to be lived in this way. And it's not worth it to me. And I said, nope, I'm going to keep pushing. So I ended up getting through the radiation, and then I had begun the 14 cycles of that everyone should take if they are HER2 positive. And those were 2 medications. And as I was taking them, I had some complications with my heart. And I thought, oh my gosh, I need that. I can't,
Yeah.
Nothing can go wrong with my heart. That's something I need, I need it to function well. And so that was a scary time for about 10 months. I was having a lot of heart problems. I had to go on heart medication. I have blood pressure medication, things I never in a million years would imagine that I would be experiencing. I was enduring. And so I was able to complete the treatment, and I had my first breast reconstructive surgery. And I thought, thank you, Lord. I finally made it. I was celebrating. I said, I did this. I made it. I rang that bell for chemo. I rang that bell for radiation when I finished. And this is the last step in this journey.
So how long had you been going through treatments at that point?
So I started in my treatment started October 2022. And it ended April of 2024.
Wow.
So that was quite just ongoing, no breaks.
Were you working during this time, Dr. Springs? Because you are a busy lady.
No, I wanted to work in the beginning, but I was going through so much physically, and the toll that it took on me mentally and emotionally. I thought I was losing my mind many times. The medication was so strong, I couldn't think straight. I remember contacting Gina. I'm like, Gina, is this chemo brain real? Because do I get my brain back? I remember text. I'm like, am I going to get my brain back? Is it my normal? Because I can't think straight. I can't remember anything. I thought my car was stolen because I forgot where I parked it. It was just so many instances where I was like, I need to just focus on myself and my healing journey. And then I'll get back to work as soon as I'm able to recover and heal a little bit more. And Gina was like, yes, it's going to come back. This is normal. And I felt that immediate relief. Like, okay, there's someone else who understands what I'm going through. So yes, a lot of bumps along the road, but I made it to that final step until it
Certainly did. I mean, you are a beautiful lady, and you are and Gina are living and breathing testaments of just how strong and resilient we are as women, and how we can overcome so many challenges. I mean, to look at you today, to look at Gina today, it's just so remarkable.
Thank you. Yeah,
so you had your second reconstruction. So you were about to go into details there. Did that have any side effects?
Oh my goodness. So at the first reconstruction, I was excited. I said, thank you. Yes, put the implants in. Let's put these babies back on so I can, just live my life again as myself. As I feel comfortable in my own skin. And that's all I wanted. I wasn't expecting perfection. I was just wanting to feel comfortable in my own skin. I had the reconstruction. I said, I'm flying. After everything seemed okay, I flew to California to celebrate. A few days after I got here to celebrate with my family, I ended up in the hospital with sepsis. And they said, if you don't take these implants out and everything along with it, immediately you will die. I said, oh my gosh. I just was so devastated.
Oh my God, I did not know that.
I was so heartbroken. It's hard to even come up with the right words to describe the feelings I was going through. I felt so alone, so scared. I felt betrayed. Like, why is this happening to me? Because I'm supposed to just get this surgery and be done with it. And I said, okay, I want to live. They said, oh, this is fixable. We can find doctors to fix it eventually. And so I was in the hospital for a while. The sepsis was cleared. They took everything out and I had to go completely flat. And that's an experience I have never had in my adult life. So that was very difficult for me to experience, my body in that way.
Because after your mastectomy, did they immediately start the volume expansion? So you felt like there was something. Wow.
Yeah, after the mastectomy, they already had the tissue expanders in with some volume, so I was never flat. It was always something there.
And they took your nipples as well?
No, they didn't. Not that time. I had nipple sparing surgery with a double mastectomy. With the first reconstruction, everything went fine. but after I had sepsis and they took everything out, I had to go in for a second reconstruction, which was a 2-part process. And well, now it's a 3-part process, but it was so difficult. It was just, I don't even know if I have the words to put, and I'm a very well versed in vocabulary and able to articulate myself well. But when it comes to circumstances like that, you're almost speechless, because I had lost something that was, I felt I lost a piece of me again. So it was like a re-experiencing, that lost. So I had the second reconstruction set up, and I said, I need to be with the top surgeons in the country at this point. I did not trust. I had some challenges with the previous surgeon, with the aftercare. And that is just something that, not everyone would think of. It's how important that is the aftercare, and knowing what to look for if you're not healing correctly. And I think some of my concerns were dismissed. But I think the most important part is what I've learned is about advocating for yourself. When you see something is wrong, speak up and make sure that you get the second opinion if you need to make sure it's your health that's on the line. So I learned a lot from that situation. I did end up getting the second breast reconstruction that started in January of this year. I had to wait. I had to wait 6 months to get the follow up. And the first reconstruction was they took part of my back, wrapped it around the front. It was a back flap. So now I had a big scar going across my back, and they took that and made a breast on the left side. And that's when I did not have a nipple on the left side. So I thought, oh my goodness, I'm just looking so different. But the surgeon was incredible. I mean, what he did and how he reconstructed everything was nothing short of a miracle.
Wow.
And I look at him today, I'm like, wow, this is just incredible. It's a medical science and what they're able to do. If you have the right surgeon and surgical team, it's truly amazing. I'm so grateful for the right surgeons who were able to support me through that part of my journey. I had the second round of reconstruction, which was in June of this year. And everything went well. I've healed. I do have to go back in for a little touch up, but that's to be expected because not everything comes out perfect. And sometimes I'm a perfectionist, so I'm like, this one's a little bit not sitting up like this one. So they were so kind and gracious that they were willing to fix it to my liking. But
Wow.
I'm so grateful. I have so much gratitude in my heart that I'm able to sit here today and share my story, because it's a blessing. Each day that I have is such a blessing to be here. And when I look back on what I've been through, I still can't believe I made it.
Mm-hmm. So, Dr. Springs, how do you live life differently after this ordeal and diagnosis and treatment and just this whole journey that you've been on?
Yeah, I am so much more intentional about my relationships with people, as far as making sure that I nurture them differently. I think beforehand I was really just focused on let me, go on the career ladder, let me pursue my dreams and goals. And I had to slow down and always being busy and doing things, and say, let me focus on what is truly important. Let me carve out time that I know that I need to nurture the relationships that I have with people, because that's what's most meaningful to me. It really expanded my faith. So, I've always believed in God, and I that's something that's been, very important to me. But, I've just thought that was something that really helped me get through such a difficult time. So I do hold on to that when I experience any difficult situations and stressors, because they do come.
Yeah.
I just had a cancer scare last month.
Again?
So I just had a cancer scare last month. Yes.
My
And
God,
they're still assessing, but yeah. And it was,
it's gonna be
I
fine.
was in that point where they were like, we think you have stage 4 cancer in your bones. And I thought, no. Yeah, they did last month. I went in for an MRI because my back was hurting, and this is how things can happen so quickly. I went in for an MRI. I was having back pain, um, and I thought, I've had a lot of issues with my back. It's been broken before. This is probably. I just want to get it looked at. No, never in a million years would I ever think I would get a report that says a suspicion of cancer. We see something there. Next phase, MRIs. Next phase, CAT scans. And everything is saying it could be cancer. There is something wrong. And the oncologist team, they're saying, and we think this could be cancer.
This is
So they
happening
did.
right now. Wait, this is happening
Yes,
right now.
this is
Last
last month, right now. This is in July. Yes.
Okay, okay. I'm
This is
sorry. Keep
happening
going.
July to August. This is currently. And so they said, well, we are going to do the biopsy. So they did the biopsy, and it came back that it wasn't cancer. I went through the same, waiting 7 days. My heart at this point, I'm like, breast cancer is one thing, but when you get to stage 4, that's just a whole nother ball game. When you get to metastatic breast cancer, you're it's like you're in a different category totally.
Yeah, yeah.
um and I didn't want to join that club. I wanted to experience some relief and some life of just living and enjoying life, because it had been so long since I was able to do that. I didn't want that burden on me of how am I going to survive this. I ended up, working with my oncologist team, and they said, we don't see it, but we're still concerned. So you need to come back for we have a special machine that specifically targets if you have, because hormone positive cancer could lead to bone cancer. So they said, let's see, we can use this machine in 3 months and we'll see if there's anything in your body. And this is the most difficult part of that conversation was, well, why can't we do the screening now?
Right.
Why do I have to wait 3 months for you to tell me whether I have stage 4 cancer? Why? He said, oh, this is a very expensive test. It costs $10,000. It's not just like a PET scan. It's much more sensitive. Your insurance won't allow it. And I said, oh, this is the part of the healthcare system that is truly broken. And so many women are facing these types of challenges, unable to get access to care that they need.
We hear this so often, Dr. Springs. It's
Mhm.
so many of our guests have shared a similar experience, and it's so disheartening. I can't even believe that we have to do this
Unbelievable.
for ourselves. Mm.
Yeah, it's so many things that need to be, fixed. And so, again, I just hold on to my faith. I am so intentional about how I manage my time.
Mm-hmm.
I love what I do. So teaching and doing research is something I'm passionate about. So I'm blessed to be able to do that. But I spend a lot more time with family. I slow down. I take care of myself better. I recognize what's going on in my body. And so I think, making sure that I set boundaries to protect my peace, is very
It's my new
important.
motto,
That's one.
protect my peace. Yeah.
Yes, it's protect it.
Yes,
Protect your peace,
protect my
and
peace.
don't let anything steal your joy completely. And
Yeah.
that is such a challenge when you're faced with, for lack of better words, life or death situations.
For
No,
sure.
100%. And I think it's so important, for people that are listening that, maybe have cancer scares or are going through breast cancer right now, and to know that there are resources and people out there that are willing to talk to you and help help you get through it. And, one thing that I am such a wholehearted believer in, and obviously Dr. Tara is as well, is therapy. And, really finding a therapist that you trust, that you can talk to and open up to, that, has experience dealing with cancer patients, or, anything of that matter. How have you seen that help you evolve through this process?
At first I didn't want to talk to anybody because I wanted it to go away. I just wanted to, I was trying to compartmentalize and like, okay, let me just put this to this side. I don't want to talk about it. I don't want to relive it every second. I don't want all those feelings, to be managed out in the loud. But
Right.
and I realized I am suffering inside, and I'm suffering in silence in many ways because as much as the caregivers around me, want to support me and understand me, I knew that I needed, a professional. And it was a tremendous amount of support. Connecting with the right person is key. I had a wonderful therapist who I still communicate with,
Good.
and met with me, and I'm laying in my bed in my robe like this on my phone talking and crying, but I felt this relief afterwards because that's all I could do. And I couldn't leave the house. I didn't want, I was able to do it virtually, which I think is another big advantage in terms of telemedicine now. You can have therapy that way. And yeah, it changed my perspective on my healing journey. The guidance that I was offered, really uplifted me. Not just uplifted my spirits, but you know, gave me an opportunity to focus on things that really mattered instead of just, oh my gosh, I might die.
Mm.
It's how can I live? How can I make today a good day?
Such beautiful wisdom, and I think such an inspiration for our listeners, especially this month as we try to be a beacon of hope for
Yeah.
people that are struggling, and to give insight to people that maybe are having this experience with a loved one. So it's beautiful words of wisdom.
Yeah.
Well,
I
I
was
was
I was
talking to
saying
Dr. Springs and asking her where she was from, if she was a New Jersey native. And she explained that she was from California, but moved to New Jersey to be closer to family who were not there in the way she expected, right?
No, and that was one of the most heartbreaking experiences, because I was facing a life and death situation. And when I told everyone, I said, I have cancer, it's spread, I need help. I was not
Yeah.
quiet about it. I said, I need help. And so everyone, oh, yeah, we're going to help you. We're going to be there. We're going to do this. We're going to do that. No, no, I didn't have that. Like my brother, for example, he was missing for months and months. I remember reaching out to him saying, I don't want to live anymore. I don't want to go through this anymore. I don't have anybody. I can't do this. And he said, sis, you deal with your problems and I'll deal with mine. And I'll never forget that. I had uncles, I had cousins who just turned their backs and went the other way. Fortunately, I had two women, two of my cousins, who were there for me, one on my mom's side and one on my dad's side. And they stepped up and were supportive of me. But that is, some of the heartbreaking things that I think a lot of women who are diagnosed experience. The people that you think will step up and be there are the people that may walk away.
Mm-hmm.
And for whatever reason, they did that. And I learned a lot. It was the strangers who really stepped up and supported me. It was those organizations, those nonprofits,
Wow.
of supporting women with breast cancer. I can't tell you what a saving grace, those organizations were. It was my medical team who was almost seemed like family to me, because they were there, text message away, a phone call away, supporting me through every step.
Thank God
And
for
that is
that.
a phenomenon, when like they say, when the going gets tough, the tough get going, or whatever. But it's true. When you go through hard times, it's often a surprise who's there and who's not. But I think, Dr. Springs, that it's hard for people. They don't want to see. They don't want a front row seat to cancer and cancer treatment, and it's hard to handle. I mean, it is not for the faint-hearted. The two of you can attest to that 100%. But it is disappointing when you need the emotional support and the people you think would be there are not.
Yeah. So what do you do now to kind of stay sane now that you've kind of come to the other side of this?
I think, like I mentioned before, I practice a lot of self-care that I didn't do, whether it's meditation and prayer, whether it's taking time out to spend with family. I have booked so many trips every month. I said, you know what, let me get back to
I see
doing
you out
things
there
that
living your best life, Dolores. I see
I
it.
am booking trips.
I
In
see you.
Dubai in 2 weeks. I'm going to New Orleans next month. I'm going to Hawaii in December. I am going to live life. I'm
Get it.
not going to sit by and wait for a doctor to tell me how to live my life. I didn't choose cancer, but I chose the way that I walk through it. I choose every day to build a life that feels like healing to me. Uh, and those are important words that I would hope would resonate with other people who are possibly experiencing the same thing. I don't push myself past my limits ever. If something doesn't feel right physically, mentally, emotionally, I stop and I say, you know what? I need to step back and take a break, because it's not just a physical, impact you physically, but it impacts every area of your life. So I'm living life and I'm
Get it,
enjoying
girl.
it,
I see
despite
it.
the challenges that go on. I said, you know what, nothing's going to stop me from living life. I fought too hard to get to where I'm at today, to not enjoy the blessing that it is to be present.
I love that for
Amen
you.
to that. I am picking up everything you're putting down. So thank you for that. Seriously. I mean, I'm in lockstep with that mentality and I preach the same. So good for you. That's a beautiful thing. So here on this podcast, Dr. Springs, we ask all of our guests, what does well-off mean to them? So what would your answer be?
That's a really good question. I think, what, to me, I think it's an alignment with, you know, with who I am, the freedom to live by my values. I think, to give generously, to rest and not have that be burdened with guilt, to work with purpose, to love without fear. Um, and I continue to say this, to muster up the energy, for the people who matter, to
Love it.
give back in some way, be of service. I think Welloff, is a life about my health. It's about my time. It's about my relationships, um, and whatever resources that are in the right order that I can share. I think it's about wholeness, things that money cannot buy.
Love it.
I love the list. Perfect.
Yes.
So beautiful.
Oh my God. Thank you for sharing all of this. I know I just recently aired an episode of myself talking about this, and it is so emotional. And I mean, it's a lot to rehash everything and go through it. So thank you so much for taking the time to do that and to help, anybody that could be listening.
Thank you so much for having me. It's been a pleasure to speak with you and meet with you today. If my story can help anyone, it's worth sharing.
Yes,
Thank you.
absolutely.
Thank you for being brave and taking the time and to be so generous with your history. And God bless you. You will be in our prayers and
Yes.
keep living this beautiful, blessed life, because it is a gift.
Yeah. And if anyone wants to find you or talk to you, how can they get in touch?
I'm on LinkedIn under Dr. Delores Springs. So they can reach me there. Pretty easy to find. And that's probably the best way to reach me. My email is there.
All right.
You can direct message me. I'm also on Instagram, but I'm not on there as much as most people are. Under Dr. Springs, no, Dr. This professor. I think DS Springs a professor. I just changed my name.
I
3 months
mean,
ago.
we'll find you. We'll find you. We'll find you. Yes. Oh my God. Well, thank you so much, Dr. Springs. We will talk to you soon.